The other big question here is the cost of these therapies. Docetaxel, for a course of about 6 cycles, when you add it all up, including the infusion cost, the cost of drug, is probably closer to $10,000, whereas for 1 month of therapy with abiraterone, it's about $8,000. So if you're on abiraterone for 3 years and a patient's cost is about $8,000, what a patient may pay could be anywhere between $5 and $8,000, depending on their copays or their out-of-pocket expenses from that. So it's a very complicated financial proposition that may arise when you're discussing this with patients, especially when it's over a 3-year time period, which is the average amount of time that patients were on abiraterone when started with hormonal therapy. If you start with docetaxel and you put them on a treatment break and the PSA starts to rise, you add the abiraterone on, you may only be on it for an average of 18 months, which is half the time frame of what the abiraterone would be if you started with it up front. So it's a complicated conversation, balancing treatment burden, ability to receive docetaxel, as well as the cost of therapy, both to the institutions as well as the patient's out-of-pocket expenses. So when all is said and done, either option is appropriate, and we need to tailor the therapy to the patient's situation, both their financial situation, their physical well-being, and their patient preference.